Hello and welcome to webinar series. So myself Shanti, and today's topic for discussion is all about on the rising concern on obesity care and few advancement. Yes, as you know, this is a very complex and chronic condition. And for this, I'd like to welcome our expertise, none other Dr. Konalakshmi ma'am, who is our minimal access and robotic GI, metabolic and bariatric surgeon from Yashoda Hospital, Somajigoda unit. I welcome you, ma'am.
Thank you.
Thank you, ma'am, for accepting this invite, though you are, engaged with your patients and all. Yes. And I also like to welcome all our speakers. So kindly, I request everybody to just introduce yourself. Firstly, we'll start with Emmanuel. Yes, Emmanuel, over to you. Yes, if not Emmanuel, yes, Pushpa, you like to start, and after that, we'll hear from Bindu.
Yes, ma'am. Very good afternoon, Ed. I'm Pushpa. I'm a senior nurse manager. Right now, I'm working with a high-tech city, Yashoda Hospital. And Shanti ma'am and ma'am, I'm really happy and to share this platform. Thanks for giving me this opportunity. Over to you, ma'am.
Yes, Bindu.
Yeah, good evening, ma'am. I'm Bindu Priya from Government College of Nursing. I'm working as a lecturer here. I'm very glad to be in discussing with this burning topic. Is obesity just a weight or an disease? So
Yes.
I'm really very privileged to be a part of this panel. Thank you, ma'am.
Yes. Emmanuel, are you there or we are just going to start? Okay, unless until he joins. Yeah. Ma'am, as we know that we are talking about obesity, and I was just going through a lot of your health talks and your vlogs, and very recently you did a very mega conference as well. And the question remains the same, like, is obesity just a weight, or do also we get to see a lot of hidden comorbid diseases as well? Over to you, ma'am, for your expert insight. Yes.
Yeah, Shanti, thanks for talking on this burning topic.
Yes.
And obesity has been gradually increasing over time in our country, and it was not recognized as a major health problem. But now we are seeing that more and more people are getting affected with this problem. And obesity, you understand, is a disease.
Yes.
It's not
Yes.
just superficial. It's not just some weight, you need to lose some weight. It's not like that. It's a big disease, and with it brings a lot of other diseases. So one disease, and it is mother to so many other diseases. So it is the seed for so many problems. So if you want to treat diabetes, if you want to treat heart disease, and if you want to treat polycystic ovarian syndrome, and the patient is obese, you don't treat obesity, the diseases will never get treated. All of
Yes.
them are one platform, and obesity leads, these follows.
Yes. And that is the reason, sometimes in the clinical scenario, we get to see patient may be posted for total knee replacement or gastrectomy, but primarily we need to see what kind of comorbid condition they have. He might or she might be also suffering with the OSA, which is obstructive sleep apnea, etc. Yes, as rightly said, yes. So yes, Bindu, we like to start from you. Yes, do you have any concern to be, have madam's insight on the same? Over to you.
Yes, ma'am. I just wanted to have an insight into like nowadays prevalence of cancer is very much more, ma'am. Does obesity have an impact on does obesity cause cancer actually? I
Yes,
just wanted to.
obesity causes cancer. Obesity is directly linked to 13 odd cancers: breast, ovarian, endometrial, pancreas, colonic cancers. Obesity is one risk factor.
Yes.
So if a person is obese, they have a high risk of developing these malignancies. That is what you're seeing: more females, more breast cancers, more endometrial cancers and ovarian cancers happening
Yes.
in the just when they're touching 45 to 50 years, they're developing diseases because of the obesity. It is not, you need not be morbidly obese to get these diseases. Even if your ideal body weight is 50 kgs and you are 60 or 65 kgs, means that 10-15 kgs excess body weight is enough to cause these diseases. That is what people have to understand. People think that someone has to be huge to get diseases. No. Even a slight increase above your ideal body weight
Hello,
will
sir.
push you
Sir,
to
am I
develop
audible or no?
deadly diseases.
Yes. Yes, that's what when we were discussing, and nowadays when I see a lot of your health academics, and then like as nowadays this is popular that sitting is second smoking, second form of smoking. So even I consider myself obese. Why? Because my BMI is between 25 and my weight also is on higher side. And I may potentially invite a few risk in, if at all I don't manage my weight. Yes, I think yes, ma'am. Yes, going forward, is obesity considered a global burden of disease as a non-communicable disease? Yes, ma'am. Over to you.
Yes, obesity is now a global disease. Earlier, obesity was seen more in the Western world, but with the
Yes.
Western culture coming into every part of the world, once we were having only 3% of population obese, whereas
Yes.
the Western world was having 30 to 50% population obese. But recent statistics are showing now 30% of our people are overweight to obese, and 50% of the children,
Are
Hmm.
obese.
50% of the children are going towards the morbid obese group. So that is very dangerous.
Yes.
Because in our country, our strength is the young working force.
Yes.
Okay, but in another 10, 15 years, if these kids, they become sick individuals, then the country's productivity will dip.
Yes. So yes, going forward, yes, Pushpa, you have any concerns about this rising epidemic, which is again obesity, and you wanted to ask a few insight. Pushpa, over to
Yeah.
you.
Yes, ma'am. That's ma'am, Kona ma'am. Yes, you rightly said that nowadays, even my kid also, though it's I can say is obese or over, it's very chubby. I wanted to say that how we can get rid of this one, ma'am. Means like how, as a mother or as a nurse, how I need to tell to the kids or even the mother parents about this, ma'am.
See, one is we have to get back to our old eating habits. The traditional Indian food, what we had, rice, vegetables, pulses, some little meat or fish or egg, and then exercise activity. Do your activity, especially for children. We are curtailing their childhood and activity and play time by having big goals even just when they're born. We want them to
Yes.
join IIT, we want them to join big, big institutes. When the child doesn't know anything, doesn't understand what is IIT, we are forcing them, we are cramming them, making them sit for hours together, not allowing them to play. There is no exercise. So first, we as mothers, all of us as kids, and all of them have that problem that they need to lose 10, 15 kgs. Okay. So we need to encourage family eating, curtail the amount of food that is cooked daily. Don't pamper them with food if they achieve something. Buy some dress, buy books for them, but not food. Don't indulge them in high calorie food.
Yes.
Come, you study, you do homework, I'll buy you a chips packet. Let us go out
Yes.
and eat ice cream. Let us go and weekend, let us go and eat all this junk chaat and pizza. And no, no, that is not. We were not, when we were kids, we never had this. Okay. But now generation is getting trained and understand. We
Yes.
parents are training them like this when they become self independent.
Yeah.
When they have money in their pocket, they will not eat healthy. That
Yes.
is why now you see youngsters, they don't want to cook at home. They don't want to spend time in the kitchen. Just call and order food. But
Yes.
what is that
Yes.
food coming onto your table is unhealthy food.
Yes.
So this changes parenting, people who are dealing with young parents, young children, even if they come for anything as something as common cold or cough or something else, but you find the child obese or chubby, educate the parent that this is not good. We think, why should I bother? No, we have to bother. If we don't bother, more and more obesity will proliferate, and then more and more people will fall risk to this deadly disease.
Yes. As you rightly said, everything comes to them. Like nowadays, there's a food delivery platforms and this Rapido, like bike taxi. The moment you deliver, the moment it is, and very few seconds it is, served to you. Yes. And yes, like again, yes, we have Emmanuel who has logged in. Yes, Emmanuel. Let us also hear from Raichu, like what Emmanuel has to, have his doubt about. Yes, Emmanuel.
Yeah.
Over to you.
Yes, ma'am. Thank you, ma'am. Ma'am, I want to ask you, like, how much do genetics and hormone influence obesity compared to lifestyle factors, madam?
Recently, when we did this false bariatric course, there was one discussion.
Yes.
Is obesity a genetic disease, or is it more a lifestyle thing which later causes hormone genetic change?
Yes.
See, to form any genetic change in generations,
Yes.
it takes ages.
Yes.
See, evolution, man didn't evolve in 1 week or 1 month or
Yes.
1 year. You
Yes.
understand, billions of years for one change to happen.
Yes.
But then we say that in one generation parent is thin built and next generation child is obese. We can't
Yeah,
call
we
it
see the
genetics.
pattern, different
Ah,
patterns.
so it is environmental factors affecting that individual person's gene. He has not been born with obesity. He is made obese because of the obesogenic environment.
Yes.
At the same time, if you have obese parents, then the child is again born already primed to become obese
Yes. Yes. Yes.
because of the parents' health condition.
Health condition. Yeah.
So, first is that the maternal part, when the mother is there going through the pregnancy, she should be treated to a healthy diet.
Yes.
Earlier, it was they used to feed the mother so much that the mothers used to bloat up like
Yes.
anything. And what happens is, because, as I said, obesogenic environment. So you are creating a obesogenic environment for the mother. And the mother transfers the same thing to the child. So now mother becomes obese, the child born is already primed to become obese.
Yes.
So we have to change the obesogenic environment around us. Curtail food. Curtail the type of food, the quantity of food. Some people just become obese by eating lot of rice or dal, regular food. They
Yes.
eat and they become fat. That is because they're eating big quantity. So quality control, quantity or portion control, and exercise.
Exercise. Physical
Activity has to
activity.
be there for each and every person.
Yes. So, ma'am,
Then you can do it.
yes. So here I like to also ask, like, few, common myth maybe, or it is a really fact. Like everybody says that even we see our mother and our grandmas and all, they say if you eat, maybe the portion doesn't matter, it may be a bigger, but at the same time, if you do physical strain of exercise, so it is not going to contribute to the obesity. Is that so, ma'am? Like at this current,
Means
predisposition
what you are eating and how much activity you are doing.
you're doing, yes,
Are you doing all the manual work? Are you drawing water from the well? Are you carrying water and watering all the plants in your big farm field where we have farm? We
yes,
don't even have garden.
yes,
Okay. And
yeah,
are you grinding? Are you washing your clothes? Are you washing the whole house clothes? No.
yes,
So what grandmother work did, mother didn't do, and we are not doing. Next kids will not do that
yes,
much work also.
yes, yes,
Okay, so that concept that eat and burn it is not there. There's no place to burn your calories now.
yes,
So portion control and quality control is very important for everyone.
yes. And at the same time, physical activity, yes.
And
So
plus
here,
physical exercise. Yes.
yes. So here, Bindu, we like to have from your end, like, Yes, as we were trying to understand, like, is obesity defined solely by BMI or overweight? There are two concepts, like, if at all my BMI is higher and my weight also is much good. So, like, and absence of physical activity and no limitations about the diet and all. So how we should give the definition of this obesity, ma'am? Like contributing factors like BMI and obesity, adipose fat.
See, BMI is a very what crude calculation of obesity. Like
Yes.
someone you see bodybuilders and all, if you do their BMI also, that will come high. So you
Yes.
have to know the fat percentage.
Yes.
So that's
Yes.
why we have now body composition analysis. Now we have various machines which will give you the body composition. That in that BMI, what is the percentage of fat, what is the percentage of muscle?
Oh,
Okay, if the
yes.
fat percentage is high, that then even if you look thin and then your fat percentage is high, means you're still obese.
You
That
are
is
still
why
obese.
even
Yeah.
thin people develop deadly diseases like bad diabetes and bad cardiac things because they think we are just looking thin. They eat without any control. Okay, and they end up with this way. And one more thing is your waist hip ratio. Waist hip ratio is better predictor of obesity than body mass index. See,
Yes.
there are people who have very thin arms, very thin legs, but huge pot belly.
Yes.
So that if your waist hip ratio is more than one, crude or more than one, means you are morbid obese. And that waist hip ratio more than one is equal to a BMI 40.
Yes.
So a thin person with a big pot belly is equal to a 120, 130 kg person.
Oh,
So people think my arms are thin, my legs are thin, only my belly. But the what will kill him or her is the belly fat.
Yes. Yeah. And like as you said very rightly, and we also got to know body composition fat analysis. Like when should we do, like if at all I want to understand, because it is not commonly prescribed to among general population, or unless until patient is sick. Like when should we take this as a
No, no,
screening
no.
protocol,
Body
or
composition analysis will be done in all the qualified centers. It's a instrument where we have to put it onto that person, or you stand on that scale, and that will give you the analysis.
analysis? Yeah.
Hmm. So, but first you keep eye on your weight.
Wait, yes, yes, yes.
Weight.
That's
Okay.
a very,
What is
yeah,
the ideal body weight for your height? That is important.
that is important.
Okay.
Yes.
And then see if your tummy is bulging. Okay. If you're feeling breathless on doing small amount of activity, that means your heart is feeling the strain.
Yes.
So then go to everything. Now it is everything is do it yourself. No, do it yourself doesn't work. Everyone thinks that I want to read Google and do experiment on ourselves.
Yes, yes,
I think
yes.
that's not correct. There are trained nutritionists, trained bariatric physicians, bariatric teams, and weight loss management centers who
Yes.
will do that analysis for you.
Yes.
See,
Yes.
don't neglect yourself to a point and come to the hospital almost nearly dead.
Yes.
Then no one can treat you.
Yes. Very rightly
You
you
should
said,
take help.
yes.
You should take help. You should take help.
At least, if at all they are not convinced, they should always meet the physician and just get to understand whether they
Yes.
are going onto the right track. Whether these are all metabolic disorder. I mean, whether are they, their pattern is going right, and they can always come for the expertise opinion. Yes. So we also tried understanding, as you mentioned in the beginning itself, obesogenic environment. I think we all are living with the obesogenic environment. Like we have a big parties in the name of snacks. We eat a lot of nice brunch and snacks after 4 o'clock. Only we have a lot of teas and all oily snacks, and we give this environment to ourselves, and then potentially we invite a lot of comorbid condition for us. I think you will also agree with me, ma'am. Yes. Yes.
Yes.
The other side, Bindu, are you there? Do you
Yes,
have any
yes,
insight which should be
yes,
asked from your end? Yes,
yes,
Bindu.
ma'am. Like, does obesity cause fertility issues in males and females, ma'am?
Both.
We know
Both.
that in females, PCOD causes fertility issues. Whereas in males, ma'am, what about males?
See, in females, obese females have high testosterone levels. That is why they don't ovulate. That's why they develop PCOS and infertility and all the problems. Males, obesity causes increased estrogen levels. So increased estrogen levels will hamper spermatogenesis. So they will have high estrogen, low testosterone. Females will have high testosterone, low estrogen.
Low estrogen level. Yes.
Either ways, obesity is a major cause of infertility in males and females.
Both. Yes.
Thank
So
you.
it was very right question, Bindu. I appreciate that. Leaving all the barriers, you have asked this question. I appreciate this. Going forward, yes, we are trying to understand the few new current advancements or approaches in treating obesity, ma'am. As everybody knows obesity and relatively bariatric surgery in terms of robotic and gastrectomies are all very very low awareness among the common population, even the healthcare professionals are not seen at all. Anytime when I ask a bariatric, surgery, they are not able to define us. Bariatric surgeon kuda untunda ani that awareness be, like that. Yes. So over to you, ma'am. In this, we will always have a lot of insight from you. Yes.
Yeah, bariatric surgery is an advanced GI surgery which is done on the stomach and small intestines, which reduces the quantity of the obesogenic hormone called ghrelin and increases the anorectic hormones like the GLP, GIP, peptide YY. Okay, so that is how bariatric surgery works. So it is a complete, all these hormones come from the intestinal tract. So if we can alter their levels in the body, then you can achieve a change in the metabolic syndrome. So when you alter the metabolic syndrome, then we see weight loss, we see sugar coming under control, hypertension coming under control, dyslipidemia coming under control, PCOS reversing. In males, once their weight comes down, their testosterone levels improve, their spermatogenesis improves. In females, testosterone levels comes down and their ovulation improves. So all these hormones affect one hormone, that is the insulin. Initially, when the person is obese, there is insulin resistance, and that is why a lot of inflammation in the body. That is why all these troubles happen. But once you alter the hormonal defect, then the inflammation settles down, the insulin resistance improves, and the person starts doing well, not only with the weight, but with all the other associated metabolic issues.
Overall well-being is felt. I think with these all
Yes,
benefits, yes.
yes.
I would like to, yes, any, speakers, the other side, do
Mm.
you have any
Yes,
thing to be
ma'am.
asked to ma'am? Yes.
Yes,
Since
ma'am.
we are talking about the advancement in the full-fledged tertiary centers. Yes, Emmanuel or Bindu or Pushpa.
Yes, ma'am.
Ma'am, I just wanted to know that there's a drug called Monjaro available in the market. Does this injection really work on weight reduction, ma'am?
Yes. Monjaro and Ozempic are all GLP, GIP analogs, means they're synthetic GLP, GIP. Okay.
Yes.
They are ideally anti-diabetic drugs. Okay. But at a bigger dose, they give weight loss. But they don't give major weight loss like a bariatric surgery. They will give you a 10 to 15% of excess body weight loss, provided the drug is taken for lifetime.
Are there
Oh,
any
that is.
complications using this drug, ma'am?
Yeah, GLP, GIP, you understand here at a steep dose, we are getting weight loss as a effect or a side effect. Okay. So when you are giving a high dose of GLP, GIP have a static effect on the intestines. So
Static.
it will cause gastric immobility, pancreatitis, gallstone disease. It can affect the retina. So because it's a drug, it's a chemical.
Yes.
So when you are giving a high dose of chemical, like if you give a high dose of paracetamol, you should be ready for a liver failure.
Yes.
Okay. Simple
Yes.
paracetamol for fever is fine. But if you're giving very high dose of paracetamol, you can end up with a liver failure. So like that, these drugs will give you weight loss at a very steep dose, and that too, you have to take them for lifetime. Whenever you stop the drug, the weight is going to come back.
The
Because
rebound
they are
weight.
synthetic analogs, they always will get metabolized and removed from the system.
Yes. So yes,
Thank you.
this we wanted to ask you because a lot of everybody is talking about Monjaro. Yes, oral drug. Yes, very rightly you said, ma'am. And as you also said that it does not may work for the comorbid
Yeah.
obesity. Yes, sorry, morbid obesity. Yes.
Yes.
So Emmanuel or Pushpa, do you have anything to be asked
Yeah,
to?
Yes.
yeah. I have a
Shortly.
question, madam.
Yes.
Dr. Kona.
Uh,
Sorry, carry on.
yeah, ma'am, I have a question. Like, what are the evaluations or investigations that could be done before deciding on bariatric surgery, madam?
The first is roughly is the patient's BMI.
Yes.
Only when the patient is above 35 BMI or above 30 BMI with metabolic problems, we offer them bariatric surgery.
Okay.
And between 25 to 30 BMI, in which most of us fall, for them it is still diet and exercise only.
Yes.
Okay. Okay.
If that 5-10 kgs is difficult for some people, they can try Ozempic or Monjaro, but understand that to keep the 10 kgs away, lifetime of medication is necessary, and every month it will cost you around 20 to 25,000.
Wow.
Oh, that's a
That
huge
injection
expense.
comes at a cost of 25,000 per month for rest of your life. Whereas surgery is a one-time investment. Your 1 to 2 years of medication cost will give you a surgery which will work for lifetime and without major drug interactions or drug effects.
So yeah,
So
yes.
drug has to be used carefully under supervision, and someone has to keep following up that patient. Otherwise, you don't know that suddenly you are end up in you are taking the drug and no one knows you are taking the drug, and you end up in a hospital with pancreatitis or bowel gangrene, and then people are confused.
Yes, yes. And I heard it is, shortened in the market also because everybody is taking for the weight loss and the real users who are diabetic patients, so they are not getting the thing.
They are not getting the drug. Yes,
Yes, yes,
people
ma'am.
just people still live in that false world
Yes,
where they think that I will just pop one pill and I'll be get rid of disease and I will just become thin like a model, because the influencers talk like that. Now it is influencers era. See, people can sell them anything. That is why we see a lot of frauds happening, financial frauds, anything, huh? Emotional frauds. Why? Because people get so carried away by what is just publicized in social media. And then after they get damaged, then they start crying.
yes, yes.
Yes, ma'am.
Logic
And
is logic is not there. Logic thinking is not there.
yes, yes, yes.
So,
And
ma'am,
I think
I
these
want to
are just OTC, over the counter also. I think it is they are getting, or maybe with the prescription, controlled prescription. Yes. So
They
yes,
are not getting over the counter, but if one relative is prescribed medication, he will distribute that medicine to all his family members. So that is
yes, and
dangerous.
to have that, placebo feel good effect. Yes.
Yes.
Yes, yes. So yes, obesity is a very big ocean and some subject to be spoken to, but we have a time-bound session. And yes, yeah, I would like to ask Emmanuel, Pushpa, and Bindu, do you know World Obesity Day also we celebrate, no? And when it is celebrated, do you have any idea? Pushpa? No? Yes? Yeah, the question is only for you guys. Yes, it is always
yes,
celebrated on
please.
4th of March, and you can just click on our Yashoda website. You may see a lot of, as I keep seeing a lot of blogs and health talks by ma'am. because World Obesity Day unveiling the health impacts of excess weight, not only bariatric surgery or not any surgical interventions. So yes, stay tuned, and we'll again further connect. I like to thank ma'am for your valuable time, and I like to thank all the speakers. Any other questions or any insight you can just quickly ask, and we can wind up.
Yes, ma'am.
Yeah, ma'am,
Ma'am, actually,
can I go ahead, please? Ma'am,
yes.
Dr. Kona, I wanted to ask because these all Monjaro, all these things, it's like you said that it will be we need to use for a lifetime. Again, after the bariatric surgery also, is there any rebound for the obesity, ma'am? I wanted
Yes.
to know from your insight, ma'am.
Yes, you understand. With age, as we age, body will pick up some weight. Okay.
Yes.
So once we have given you a weight loss with the surgery, you have to maintain that weight loss with diet control and exercise. If there are people who will get the procedure done but never exercise or never think, but it is seen, the recent literature says that only 6%
Okay.
of all the bariatric surgeries will gain weight. Will have some only 6%.
Okay. Okay.
Only 6%, yes.
Only 6% of so many thousands of bariatric surgeries done will have some weight regain, and less than 1% will regain back all the weight.
Yes.
So they will have certain degree of weight loss and maintain certain degree of weight loss, which is the best part of the bariatric surgery. Means even though that person is so negligent and so not even bothered, still they will maintain at least 15-20 kgs of the weight loss they have achieved. Suppose a person has lost 50 kgs, maybe after 20 years or so, he will still, even if he gains back 10 kgs, he will still maintain that 20-30 kgs weight loss. But with Monjaro and Ozempic, no, it will just come back. Everything will just come back as it is.
Yes, yes.
Yeah, ma'am.
Yes,
Thank you.
as I was mentioning, we can ask a lot of queries, but then again, we have a time-bound session. Yes, thank you, Pushpa, Priya, and Emmanuel, and a very big thank note to Lakshmi ma'am for clearing a lot of myths and facts. And I think we need to run this webinar in a form of series, because yes, yeah. Thank you so much, and we end the session. Thank you, Emmanuel.
Thank you,
Thank
ma'am.
you.
Thank
Thank you
you.
for the
ma'am.
opportunity.